Hi, it's Patrick Hutzel from intensivecareathome.com.au, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomy by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog I shared Intensive Care at Home achieved accreditation again and remains the first and only accredited and certified intensive home care service provider in Australia as of August 2015. You can check out last week's blog by clicking on the link below this video. In this week's blog I want to share how to save $2,000 per bed day in intensive care. Intensive care is the most expensive area in healthcare. It never ceases to amaze me that despite the high costs in intensive care that can range up to $5,000 per bed day, no think tanks or any other special interest groups have been brainstorming any solutions in how to reduce the costs in such a high cost area like intensive care. In fact, intensive care treatment for long-term ventilated adults and children with tracheostomies represent the second highest expenditure for all DRGs. DRGs stands for Diagnosis Related Groups in the healthcare system. Those numbers speak loudly, and the numbers speak for themselves, as DRGs AO6A and AO6B, which are both the DRGs for long-term ventilation with tracheostomies in intensive care, are costing the taxpayer currently around $5,000 per bed day in intensive care. Both DRGs AO6A and AO6B are also the second highest ranking DRGs in terms of costing and expenses, only after LVAD, left ventricular assist device insertion, in Australia. You can look up the data on the National Hospital Cost Data Collection Australian Public Hospitals Cost Report from previous financial years, which have been published on the Independent Hospital Pricing Authority website. You can find a link on the link below this video. It should certainly be in everybody's interest to reduce those massive expenses for long-term ventilated adults and children with tracheostomy, especially since long-term ventilated adults and children with tracheostomies have no or little quality of life and or quality of end of life in some instances in a sterile and depressing intensive care environment. It should also be in the interest of an intensive care unit to have more of their precious, scarce, expensive and in-demand critical care beds available. It should also be in the interest of health funding agencies such as the Department of Health or private health funds to reduce the cost of around $5,000 per bed day to less than $3,000 per bed day for DRGs AO6A and AO6B. So you may wonder how that can be achieved. Well, the answer is rather simple. Long-term ventilated adults and children with tracheostomies can be looked after at home instead of in a sterile, depressing and limiting intensive care environment. In many European countries, but mainly in Germany, Austria and Switzerland, long-term ventilated adults and children with tracheostomies and their families, as well as intensive care units, have nearly 2 decades ago embraced the holistic and patient and family-friendly concept of intensive home care for long-term ventilated adults and children. The concept of intensive home care for long-term ventilated adults and children with tracheostomies enables all stakeholders to benefit from this model, and it creates a win-win situation. It provides quality of life and quality of end of life in some instances for long-term ventilated adults and children with tracheostomies in their own homes. It also provides family with more time and flexibility to be with their loved ones, and also provides families with the opportunity to live their lives rather than spending day and night in intensive care. It also improves resource management opportunities for intensive care units, including but not limited to having more beds and more funds available for more acutely unwell patients in need of a critical care bed. And last but not least, once again, massive cost savings for departments of health and private health funds who provide the biggest bulk of funding for intensive care units. What are your thoughts? Why do you think intensive care units in Australia are so slow to adopt this new and innovative model of home care for long-term ventilated adults and children with tracheostomies, and has been around in Europe for nearly 20 years? Leave your comments on the blog below this video. We are also currently hiring enthusiastic and experienced intensive care nurses with critical care certificate for ventilated clients in Melbourne. We would also like to hear from you if you have a minimum of 2 years pediatric ICU experience, as we have opportunities for pediatric ICU nurses as well. Check out our career section or contact me on 041 094 2230 or simply send me an email. You can also contact me if you want to know more about how we can help you, your intensive care units and your patients and families. Thank you for tuning into this week's blog. This is Patrick Hutzel from intensivecareathome.com.au, and I'll see you again in another update next week.